Qualified, professional, and compassionate doctors talking real solutions to real health problems.
Tonight on the Doctalk show, we discuss blood clots. It is a common phenomenon that occurs especially in people who are hospitalized. You may have heard of someone who was hospitalized and suddenly dies, and the doctors tell you they suspect it was a blood clot. So today on the show, we are pleased to host a senior doctor who specializes in the field of medicine that studies blood. These are called hematologists. We are pleased to host Dr. Dungu Henry from the Uganda Cancer Institute, a hematologist with vast experience in the study of blood diseases, and is here to discuss the topic of blood clots. You're most welcome.
Thank you, Mike. Thank you for inviting me to Doctalk show.
You're welcome. And I am your host for the evening, again, Dr. Darius Wachi. So we'll dig into understanding more about this rather scary disease, blood clots, why it happens, especially in people who are hospitalized. You expect them to come out better, but suddenly they develop this unusual phenomenon called a blood clot. So, Dr. Dungu, once again, we thank you for coming onto the show.
You're welcome.
And I'm sure the public will be delighted to gain from your vast knowledge and experience in the field of hematology, or the study of blood diseases. So blood clots are becoming a growing concern these days. Many people receive news that they have a blood clot in their legs, or they suddenly died because there's a blood clot in the lungs. So people are interested in knowing what exactly are these blood clots.
Well, thank you so much for this. Indeed, 1 in 4 people who are hospitalized might die of a blood clot. Hospitalization for any cause.
For any cause.
You are at risk of getting a blood clot.
That's a very scary statistic.
But that's a global statistic.
It's a global statistic.
Global statistic.
Okay.
But to understand this, we need to understand that in our systems we have a pump, which is the heart. It pumps out blood through thick-walled vessels that we call arteries. And these are going to carry nutritious blood or oxygenated blood from the heart to the rest of the body. And then blood has to return from the rest of the body through the venous system or the veins. And these are unfortunately made out of thin walls. They don't have capacity to resist pressure, but they're made in such a way that, especially the big ones, they have valves to allow for one flow of blood.
Okay, that's from the rest of the body
going back
to the heart.
And then from the heart, blood will move to the lungs to get more oxygen, so that it can go back, and then the circulation continues like that. You pump out, it comes back, it goes into purification, then goes back to the heart, and then to the rest of the body.
Okay, so blood is this liquid within the, they call it the cardiovascular system.
Exactly. It's the red thing. And what makes it red are the red blood cells. It also has white cells that we are not able to see. And it has little cells that look like small plates. We call them platelets. And whose job is to help us stop bleeding when we have an injury. Okay. So for blood, under normal circumstances, blood should be able to flow without clotting in the system and without excessively being light, so that you can bleed.
Okay, it maintains the liquid form within the system.
And that balance is because of a number of factors. You have special proteins that we call clotting factors. You have the lining of the vessels. The vessels are made in such a way that there should be laminar flow within a vessel. And the lining of the vessel has so many factors that help to keep blood in the way it should be. And the moment you get, for example, damage to a vessel, imagine you've cut yourself. Usually blood comes and in a few seconds it stops, or a few minutes, depending on the severity of the injury. So all that is because we have a special mechanism in the system that keeps blood flow the way it should, or if there's an injury, to stop it so that you don't bleed to death.
Okay.
So this system has to be balanced. And if something goes wrong, if you fail to control the clotting system, you can get into excessive bleeding. Like we've seen people with bleeding disorders. They go into surgery, they can't stop bleeding.
Okay.
And then you have people with clotting disorders that instead of blood remaining in that laminar flow,
In the liquid form,
it becomes thick and it clots.
Okay.
You find a person with hemophilia who cannot stop bleeding. When they get injured, they'll bleed from muscles, from anywhere, and they can't stop until when you give them the missing factor.
And it's because of the imbalance in those systems that prevent blood from becoming too thin or too thick.
Exactly.
Okay, so in regard to blood clots in particular, how exactly does it occur?
There are basically three main reasons why blood might clot. One, if you have blood stay in a vessel for a long time without moving. For example, you are admitted in a hospital because one part of your body is paralyzed. The paralyzed limb does not move. So blood will remain. And as I told you, for blood to move in the vessels, in the veins, it depends on the activity of the muscles.
Okay.
If your muscles are in one place, it means there's no pump to push it back to the heart.
So the the blood in the veins require movement of the muscles.
The more you move your limbs, it is pumped back.
Okay.
Because remember we said the heart pumps blood out. But to receive it, the vessels have to use the veins use other mechanisms, especially the activity of your muscles.
Of the muscles.
And then the availability of valves, so that blood continues in one direction.
Okay.
So if you are in a state of stasis, in a state of no movement, it means blood is going to stay in one place.
It kind of stagnates in the
and the
legs.
moment blood stagnates, it clots. It's like when you cut a chicken and you put blood in a container. In a few minutes, it will clot. The same thing is going to happen to you. So if you have a situation of inability to move, what we call stasis, blood can clot.
Okay.
Secondly, I mentioned that the lining of a vein or a vessel is so smooth that blood will continue to flow. If you get any injury or irritation within the lining of the vein, you can trigger a clotting
system.
And when you trigger that, the process will continue and a clot forms. Thirdly, if you're born with factors that make your blood more susceptible to clotting, for example, you're born with deficiencies in some of the factors that keep your blood flow, or you have a situation like you're pregnant, or you're using certain medicines that can increase your risk of clotting, then you can clot. So those are the three main reasons.
So it is stasis, when blood is stagnating. It is the structure of the blood vessel, the inner wall.
Getting injured.
It has to remain smooth, otherwise it can easily clot.
Yeah.
Or it is something, you have an external factor that makes blood easily thicken.
That's
either
correct.
due to the drugs or due to the clotting factors themselves. For some reason they increase and it can result in clotting.
That's correct.
Okay, so those three factors can predispose someone to clot. Okay, so which are the major types of blood clots people should be concerned about?
We're basically talking about two types. We have a clot that forms in the arteries, what we call an arterial thrombosis, and then a clot that forms in the veins. Those that are called a venous thrombosis. The venous clot can be deep or superficial. If it is involving, for example, a vessel on your arm and you see there's a clot there, that's a superficial one.
Okay.
And usually we don't worry so much about it.
They're not so much of a problem.
Not so much of a problem. But if you get one that is deep inside, for example, deep inside your leg, you have a vein that is as wide as this, which means a blood clot forming into that. If it migrates from where it has formed and goes somewhere else, it is going to cause trouble. So those are the main ones. And then when it goes from the vein through the heart to the lungs, now that is called a pulmonary embolism.
Embolism.
Yeah.
Okay, so after the break, we'll come back and understand more about blood clots, why they happen, who could be at risk of getting this dangerous disease. If you have questions, remember to send them on our social media platforms on Facebook, on Twitter. You can also subscribe to our YouTube handle, The Doctalk Show, and watch some of these videos that are uploaded right there. Don't go away.
You are watching the Doctalk Show.